I did my paper over avascular necrosis, and the projections I would do to check to make sure that the patient does or doesn't have avascular necrosis would be an AP and frog leg lateral hip. First, you need to ask the patient if there's any chance of pregnancy. There's not, so we can continue with the exam. First, you'd use a 10x12 cassette, put it in lengthwise, make sure it's lined up with the tube, and you put your right marker in. You can put it on the patient too, but most places don't like you doing that. What you do is find halfway between the ASIS and the pubic symphysis, and then go 2.5 inches down. And then you want to have this center line going down the middle of her leg. And then for this disease, sometimes the patient can have a fracture. So you might not want to do the 15-20 degree leg angle, but for this, I will, just to show you how to properly do it. And then you shield the patient. You can have a little bit of your lead in the collimation light just to make sure that you are shielding the patient's gonads. And then I will measure her part. Which is 16. And I will set the control panels for that. Next, I will be doing the lateral frog leg hip. First, I will change the cassette to crosswise. Make sure you have a 40-inch SID, and it's a detent. Then you change your collimation. Next, I'll have you bend your knee and let it fall out. Okay. You're going to do the same as you would for the AP. You're going to go halfway between the ASIS and the pubic symphysis, then go 2.5 inches down. And then you turn the collimator. Then you place your right marker on in the light. Then the shielding would be the same. You want to shield the gonads. Some of the light can be over the shielding just to make sure you don't cut off any of the anatomy. Measure the patient again. 14. And set the control panel for 14.